Hi, so it's Dr. Fox, and in this video, we're going to talk about what BPD is not. Very different kind of topic. There's a lot of talk about what BPD is, but in this video, we're going to talk about what does not constitute BPD. Now, if you've been watching my other videos, you know I talk about complex BPD, which is BPD that is comorbid with other diagnoses. And this occurs in approximately 87 to 97% of the cases. So we have to be on the lookout for not only what symptoms are related to BPD, but what is typically not associated with BPD. Now, as I discuss the following disorders, please be aware that I'm making distinctions between symptoms, but I'm not saying they cannot co-occur, as is the case of complex BPD, right? Those comorbid, co-occurring conditions. Also, I will touch on the big distinguishing factors, not all of them. Okay, so I want to give you insight and a firm place to start your journey to learn more. Now, if you want to learn more, you want to do a deeper dive than just what's in this video, you can certainly check out my other videos. That would be awesome. Or you can check out the purple book back there. That's complex BPD, if you really want to learn more. And it also will give you some strategies and things like that that can help you as well. So let's get into it. Here we go. Now, BPD is not bipolar disorder. In BPD, you're going to see mood and behavioral fluctuations, but they often last only hours, not days, like you see in those with bipolar disorder. Now, in BPD, there's often a triggering event. Something happened that set off the individual's core content, causing them to engage in BPD maladaptive surface content behaviors, beliefs, and patterns. Now, you can see my other videos that talk about breakdowns of core content and surface content. And in a nutshell, here comes the nutshell. And this is across all disorders. It's how we or I look at personality disorders, as this channel is largely dedicated to BPD or NPD. And it applies to that as well. So you have core content, which is what's underneath. And classic core content for those with BPD is sort of that abandonment and emptiness. And when these individuals get a sensation of emptiness or abandonment, or they feel like they're going to be abandoned or like they're going to experience emptiness, then they engage in what are surface behaviors. And we can always see what's on the surface. And that can sometimes be depression, anxiety, psychosis, other types of issues as well. And so it's important that we have an idea of what that is as we go forward, and just as I explained for bipolar disorder. So let's go on to the next disorder, because BPD is not major depressive disorder. Now, those with BPD are going to experience periods of depressive spirals. And these are periods of sadness that may last up to a day or even possibly 2 days. But the individual can still function and get to work. They still can meet their responsibilities, doing the things that they need to do. Now, in major depressive disorder, the individual is impaired to a greater degree of sadness. It's more impairing of their functioning. They also tend to experience an intense amount of hopelessness, worthlessness, a negative outlook, and helplessness. And these components, right, that I just mentioned, that sadness, hopelessness, helplessness, worthlessness, and negative outlook, impairs their ability, the individual's ability, to complete work and meet responsibilities. So that's a component of major depressive disorder, which is not the same as the depressive spirals that we see in BPD. It's different. Of course, we know that BPD and major depressive disorder can co-occur, and in a lot of individuals, it can make up their issue or their complex BPD. Now, the next disorder we're going to talk about is that BPD is not ADHD, right? Attention Deficit Hyperactivity Disorder. Now, those with BPD can get excited about something new or meeting a new person who becomes their favorite person. I have a video on that if you want to learn more. I have a few videos on that concept if you want to learn more as well. Now, this excitement may make the individual with BPD seem more hyperactive, impulsive, to the level that it impairs their ability to focus and pay attention, which leads them to make some careless mistakes. However, those with ADHD can be hyperactive, impulsive, and inattentive in a variety of settings that impacts their ability to get work done and meet their responsibilities. This also creates a long-standing pattern of hyperactive, impulsive, and inattentive ups and downs that you cannot trace back to a triggering instance. Okay? Even like you can't go back and figure out, okay, there's something new, right? They just met a new person or they met their favorite person. People with ADHD tend not to have their favorite person. So that's a big distinguishing factor between BPD and ADHD. So that's why BPD is not ADHD. But as we know, they can co-occur, and it can make up yours or other folks their complex BPD. The last disorder that I really want to touch on is that BPD is not PTSD, post-traumatic stress disorder. Now, many individuals with BPD have experienced trauma or various types and degrees, but not all. Trauma is not a criteria to qualify for BPD. Now, these disorders just tend to co-vary very often. Those with BPD tend to have fear of abandonment. They can feel empty inside. They see others as heroes or zeros, and they have this unstable self-image that is not seen in those with PTSD. Now, also, those with PTSD tend to have flashbacks or nightmares of the traumatic event, and they utilize avoidance of what are called trauma triggers, and they avoid intimacy in relationships. And this is stuff you just don't see in most individuals with BPD. But, as I've been saying, that BPD and PTSD can co-occur. And it's important that we're aware of that because that can make up that complex BPD. And I hope this video has been helpful for you in starting or even promoting the continuance of your journey of insight. And that is what is so critical. That is the big point of this channel, is to help folks gather good information, solid information that is based on research, right? That can help you expand your insight, help you make good choices, that can help you manage those issues related to BPD. And knowledge is empowerment. And the more you know, the more you can control and manage your thoughts, beliefs, and behaviors. So I hope that you found this helpful. Please leave any comments or questions in the comment section. That would be awesome. I think a lot of people get a lot of benefit out of that, so I appreciate it very much. And I wish you all the best. Please take care and be well. Bye-bye.